All right, everyone, we are live. Listen, if you are tuning in, this is the only video that you will need this Medicare Annual Enrollment Period in order to choose a Medicare Advantage plan. If you're watching this, it may be very close into the end of Medicare Advantage plan, and you're trying to figure out, the Medicare Advantage open enrollment season, and you are trying to figure out exactly what to do, right? What to do in order to get a plan, right? What if you are a veteran, if you're currently working, if you have a lot of medications, if you're a snowbird where you spend some of your time in another state and traveling around the country, if you're a person who maybe you only go to the doctor twice a year, right? Just to get physicals. Or maybe you might go to the doctors a lot and you have them scattered all over. Whatever your situation is, okay, we are going to cover it in this video. This video is very, very meaty. So make sure you have a pencil and paper out because I'm going to be giving a lot of information. So I do have to go ahead and show this disclaimer. And since we are doing this video live, please note that you are more than welcome to ask questions, okay? You're more than welcome to ask questions. I have helped, my name is Melissa D. Hall. I have helped over 3,000 people with their Medicare plans, okay? So this is what I do. I help people all across the United States with my company, the Hall Insurance Group. So let's start, So first things first, I do want to let you know if you would like to schedule a time to speak with my company, to speak with me, you can go ahead and you can hit right here. That is the QR code. You can also go ahead and give us a call at 1-888-850-6855. And you want to make sure that you go ahead and share out this video, especially with it being this urgent time of the year, because there are so many people who need help. Oh, Patrick Sharpless. Thank you, Patrick Sharpless. He said, I am very good at that. Thank you, Patrick Sharpless. He is one of my long-term clients. Again, do not be afraid to go ahead and ask a question. Since we are doing this live, I'm going to answer it live. And even for the people, if you're watching the replay, you probably are going to want to ask these questions to yourself, and I'm going to answer them. You can also feel free to ask these questions in the comments once this video is posted on YouTube, because I will be in the comments responding as well. All righty, you all. So again, we have 6 scenarios that we are going to go over. I covered a bit of them earlier, okay? And we're going to go ahead and cover them. So I want to go ahead and just jump in. I don't want to waste a lot of time. I just want to jump in to the different scenarios. And as you see yourself in one of these scenarios or one of your friends, again, please feel free to ask questions, even if it's in the comments. And again, please make sure to share this video out. Also, just to preface, even if it is past AEP time, the annual enrollment period, which is December 7th. That's when it ends, October 15th through December 7th. You can still reach out to my office as well. So let's talk about a person I like to call Miss Twice a Year, okay? Miss Twice a Year, she is a person who does that exactly, goes to the doctors twice a year. This may be a person who you just go for your checkups. You might go outside of that if you have an urgent care need. You might have a flu or a cold and you just want that checkup. That's who I call Miss Twice a Year. This person maybe takes a blood pressure medication that they have under control. They don't stay in the doctor's office very much. That is who I call Miss Twice a Year, okay? And let's see. So with Miss Twice a Year, I do have some suggestions for that, okay? Now, also, when you kind of have this profile, you all, and just kind of bear with me. I got a lot here because, again, this is very meaty. These are all my notes, y'all. We're getting down to it. Again, this is the only video that you are going to need to choose a Medicare Advantage plan this annual enrollment period and beyond. This is the only video. You don't need to watch any other video on YouTube, anyplace else, nothing. This is it, okay? So, okay. Now, you're probably, if you're missed twice a year, if this is what you're like, you're probably just getting a plan, A, because you have to, and you don't want to get penalized. 2, for the just in case, right? If you kind of like miss twice a year, or maybe you're Mr. Twice a year, let me know in the comments. Put Mr. or Miss, put twice a year, okay, if this is you. So if that is you, you kind of just need a plan for just a few things, right? Again, the what ifs, and also you're looking for the supplemental benefits like the dental, the vision, right? Things like that, maybe money back in your check. And if this is your profile, you really have a lot of options, right? And so my recommendation for you, okay, is to look at a plan that either puts money back in your check, all right? Money back in your check. Now, you might say, how do they put money back in your check? Put in the comments, money back in your check. I want to know if you've ever heard of this term before, because I know they say that a lot on the commercials, okay? Well, how they put money back in your check is this. You are charged $184 for your Part B for Medicare, okay? They take it out your Social Security check automatically. Now, if you go to a plan that says, they call it a Part B give back or a give back, putting money back in your check, the insurance company pays whatever that amount is. Let's say it's $100, just to use a round number. They'll contact Social Security and pay that $100 on your behalf. So you'll have a $100 increase in the amount you get deposited in your bank account. Does that make sense? Let me know if that makes sense. That is how they put money back in your check. And if you are the type of person that is just going for like checkups or different things like that, you're not really utilizing it, that is a good option to look into, because you do not need a lot of care, okay? Let's see. Now, there is usually a type of exchange if you get a plan that puts the money back in your check, okay? It may be a deductible you have to pay, okay, before you get care. And that is kind of fine because, again, if you fit this profile where you're only going twice a year, then, you know, preventative services like physicals, mammograms, right, cancer screenings, those types of things, you don't have to pay anything at all, no matter what plan you have. Okay. You don't. Okay. You don't have to pay anything at all. Also, with those types of plans too, let's see, there may be a reduction in some supplemental benefits. So if they are putting money back in your check, okay, it is a very good chance, especially if you have a drug plan attached, that you're going to have a lot less dental, a lot less vision coverage, right? So instead of maybe having $2,000 for dental, if you got a plan without a give back, right, putting that money back in your check, then you might get a plan that only covers cleanings, okay? Or instead of $2,000 in dental, they might not offer a vision benefit, right? Things like that. So that's the thing that you have to watch out for. However, you still have a lot of options, okay? All right. Next up, I want to talk about multiple Mitch, okay? And a lot of people fall into this category. So let's talk about multiple Mitch. And I call him multiple Mitch because he has multiple medications, multiple ailments, and he goes to multiple doctors, okay? And so this might look like a person who's had a knee surgery in the past, and he follows up with an orthopedic surgeon, You might have, he might even also be battling diabetes. He goes to a urologist. He goes to one hospital on the south side for his preventative care. He goes to another one on the west side for his primary care. That's multiple Mitch, okay? He has a lot kind of going on, all right? He's going to the doctors. Let's say this person's going to the doctors once a month, okay? Even quarterly, multiple Mitch. This person has at least 5 medications. You're like multiple Mitch, okay? Now, the number one thing that you want to look for if you are like multiple Mitch is you want to look at reducing your out-of-pocket cost as much as possible. Okay, you want to reduce your out-of-pocket costs as much as possible, because since you are going to be utilizing this plan a lot, going to be giving out a lot of money, and you want to reduce that. Okay, because it can get very expensive real quick. We all know out there that the number one cause for bankruptcy for seniors and just really for Americans is medical bills, and it can happen very quickly. And I want to go here and show you all this on the screen. And this is called a MOOP, maximum out of pocket. And basically, with the maximum out of pocket is how much you have to pay until you don't have to pay anything else. Okay, that is what a MOOP or maximum out of pocket is, and each plan has it. I think with the rule now with Medicare is that you can the insurance company can make your maximum out of pocket up to like $13,000 now. Okay, $13,000 is what you could be on a hook for with a Medicare Advantage plan. So again, if you're like multiple Mitch and you have a lot of doctors, you're going to the doctors at least, once or twice a month, it's very important that you look into that cost and you consider that multiple out-of-pocket costs when choosing a plan. Okay. Now, one of the things that you might want to, a recommendation for multiple Mitch, if you find yourself in that situation, again, make sure you're sharing this video out. I do have my QR code and also my office. You can call us any time of the day, 24 hours a day. You can schedule a same day appointment online right now. Yes, you can. 24 hours a day, we are answering the phone. All righty. So one of the things that you want to look at is, is consolidating your doctors. Okay, if you want to reduce your maximum out of pocket. And I say consolidating your doctors because in Medicare you have what you call an HMO plan and a PPO plan. An HMO plan is an HMO plan is called a health maintenance organization. They have a network of doctors and they give you a very low rate. The insurance company has worked it out with them. Okay. And that will help you a lot. So if you can get your doctors all under all one healthcare system, or maybe even just all under the same plan where you can get an HMO and not go all around and get a PPO, which I'm going to get into a little bit later in this video, then it will really help with the out-of-pocket costs. Another recommendation is a preferred pharmacy. And this is really big this year with Medicare Advantage, especially with these insurance companies. So let's talk about that. With a preferred pharmacy, this means that the insurance companies have worked out a specific rate, okay, with a pharmacy in order to give you a lower rate for your medications. So I'll take Aetna, for example. CVS owns Aetna. So if you have Aetna, you're going to pay a lower amount at CVS all around versus going to Walgreens. Okay. Walgreens may be considered a standard pharmacy. So let's say you take hydrochlorothiazide, and this is just theoretically, okay? If you take, or HCTZ or amlodipine, right? If you go to Walmart and you have Aetna, it might cost you $40. But if you go to CVS, which is a preferred pharmacy with Aetna, it might cost you $5. Okay. The difference can be that drastic. So if you're like multiple meds, you got a lot of medications and things, this would be something you want to look at to do in order to reduce your costs. You might not feel like switching, but it's very easy to switch your pharmacy. Okay. Just call your doctor up, tell them to send over the prescriptions for you. Another thing is mail order. Mail order is really a hack to save money because with mail order, they send them directly to you. It comes directly from the insurance company, their pharmacy, so they already have something worked out. That is also a good way too, in order to save money and work with a preferred pharmacy. Okay, so that is a real hack. Okay, my third recommendation is if you are like multiple Mitch, okay, is just to go ahead and get a PPO plan. All right. That is another plan to look into. A PPO plan is preferred provider organization. Okay. That's what it means. That means that you can go to any doctor that takes Medicare. Okay. You don't need a referral, right? A referral meaning that the doctor has to sign off to send you there, like you do with the HMO. You don't need a referral. You don't have to always go through your primary care doctor. And with that, you also you can go to any doctor and you have the access. Okay. PPO. Look into a PPO plan. If you just cannot get all your doctors consolidated, that is the type of plan you should be looking into. Okay. All right. All right. We rolling right along. Again, if you have questions, please put them in the comments. And I will definitely get to you. All right. Next up, let's talk about Snowbird Susie. Okay. Now, Snowbird Susie, this is the person who travels all around the country. Okay. She loves to spend her summers in New York with her husband, PPO Paul. And in the winter, they go to Florida to visit their grandkids. They love going on cruises and spending time in their home in Palm Springs, California. Also, they have a chiropractor in Palm Springs, California. They love to see there. The world is your playground. Okay. My recommendation, okay, for Snowbird Susie, if you're like this, if you're all around and you're traveling, is to get a PPO plan. Okay. Your number one thing, if you're traveling like this, is access. Okay. Can somebody write that in the comments? Access. That is the number one thing that you need, because with a PPO plan, again, you can go to any doctor in the US without pre-authorization. So you don't have to go through a primary care provider that might be in another state and, trying to get you to go in their network and all types of things, right? You don't have to worry about that. You can go to any provider in the US as long as they take Medicare. Okay, so you can be like Susie and have your chiropractor in Palm Springs, your primary care in New York, and your other doctor, let's say your cardiologist in Florida. You could do it. All right. Yes, that's right. Miss Minnie Edwards says access. Miss Debbie says access. That's right, you all. Access. That is important. And again, if you want to go ahead and reach out to our office, this is our QR code, up top there that you could go ahead and scan with your phone, or you can call us at the number scrolling at the bottom. Okay. So let's kind of just halfway, because we're kind of halfway through this. Let's talk about what we've been over so far. So earlier we talked about Miss Twice a Year. Okay. This is the person who pretty much goes to the doctors only twice a year. They don't have a lot of medications, right? And we said that they needed to look into maybe a give back plan. Just it's all about the benefits, right? Instead of all about the Benjamins, can we say it's all about the benefits? I like that, right? Then the second is multiple Mitch. Multiple Mitch goes to the doctors a little bit more. All right, that's multiple Mitch. All righty. And with this, Number one, we're going to look into costs, right? And to save costs, it's definitely we're going to look into of an HMO plan. That's recommendation number one. Recommendation number two is to look into going to a preferred pharmacy. All righty, that the insurance company has a lower rate with. And number three for multiple Mitch, again, multiple Mitch, if they're going to doctors all in different hospital systems and they can't consolidate them to use the HMO plan to get those lower out-of-pocket costs, then they should get a PPO. And then the third thing that we just went through here is Snowbird Susie. And what is Snowbird Susie all about? She is all about access, okay? That is Snowbird Susie. All right, and so what does a Snowbird get you? It is all about a PPO plan. All righty. And so Lois Pierce, she asks, what drugstore is preferred for United Healthcare? I think I can answer that. Walgreens is preferred for United Healthcare. That is their preferred drugstore that I know just right off the bat. Okay. And again, if you have specific questions, some things that I am not allowed to answer just right because this is for educational purposes only. So there are some things that I cannot answer, and those things I can't answer, I won't. And I'll just direct you to, hey, schedule an appointment with me one-on-one. We are offering same day, next day appointments, but that I can answer. Lois Pierce says, thanks. Hello there, Betty Johnson. How are y'all? Please listen. Make sure you all are sharing this out. Can y'all do that for me? Share this link to a friend. Okay, those of you all who are on my text list, you know, you all are getting this. Okay, and you all are able to ask questions. Also, if you're going to be watching a replay on YouTube. So let's go ahead. Like I said, we're halfway there. Let's go ahead and keep it going. Okay. All righty. So next. She said, I use Rialo. Is that in their network? I am not familiar with Rialo. Okay, I'm not familiar with it. All right, let's talk about Chronic Kathy. Okay, Chronic Kathy. Now, this might be a lot of you all. Okay, Chronic Kathy, she has diabetes, heart issues, kidney failure. Okay, now this year there is a very big push for people who have chronic issues like this, okay, to get in something called CSNPs, chronic special needs plans, okay? Medicare, through the Biden administration, changed the rules on how they pay insurance carriers, okay, how they grade doctors. They moved away from the value-based care system. And so, you know how everybody will always get their food cards just for anything, right? The insurance companies were kind of using it to lure people. So Medicare said, hold up. Two things are happening here. Number one, okay, the insurance companies are using this to bait folks. This isn't about healthcare anymore. This is about who can get me the best food card. And number two, giving food cards out to all the 64 million beneficiaries got very expensive for Medicare, and they said they could not afford it anymore. And to stop the bleeding, what they decided to do is say, listen, we're going to give you a food card. You have to prove to us that having this card is going to improve your way of life. So they started this whole chronic SLCI program. If you look on my past videos on my page, on my YouTube page at Melissa D. Hall, it is a video called Medicare Chaos. There I go all in about these plans, okay, and the changes. So what does that mean? If you have a chronic condition, a lot of these companies now have made what they call chronic special need plans. And with these chronic special need plans, they are giving you the food cards and all the other benefits if you have a chronic plan. Now, you do have to go ahead and prove that you do have a chronic plan. And it's just as simple as they send a note to your doctor. So it's not hard. The insurance company takes care of that. If your doctor doesn't answer, they go ahead and they send something out to them. Hello, everyone. Hello, Chris. How are you? Y'all, I see y'all. It's a lot of you all here tonight, okay? It's a lot. I see y'all watching. You know, we're streaming. It's over 50 you all watching live. now, and it's going up minute by minute. I know, I understand we are headed to the last days of AEP, so make sure you share this out, okay? So the chronic special needs plans also, what I want to get into them is that some of the benefits, besides the supplemental benefits, right? This is where the food cards went. Besides that, they help give you extra benefits, right? Like they might give transportation, okay, versus a regular MAPD plan, Medicare Advantage prescription drug plan doesn't. They might give you lower out-of-pocket expenses for chronic drugs, specific drugs. So, for example, let's say your insulin, okay, with one plan, XYZ, a regular Medicare Advantage plan, your insulin might be a tier 4, okay, you have to pay more out of pocket, might be on a chronic special needs plan, a tier 2. That's a significant difference. That's a significant difference. And you can get that on a chronic special needs plan. Now, what I do want to say with the chronic special needs plan is that each chronic special needs plan does not take the same chronic condition. So just because it says chronic special needs, if you have diabetes, that doesn't mean it takes diabetics. It might just take people with heart or kidney. So you want to know which one it takes. And you can find that in the summary of benefits, or again, asking an agent. You can do your research. It tells you exactly. Okay. And again, this video, I mean, it's so meaty. You could kind of figure this out, okay, without an agent, but I am here. So somebody said, oh, what's up, Miss Nikki? Joyful evening. Hello, hello. Somebody said a disabled veteran uses medical benefits, so I don't use my HMO that much. My chronic condition is diabetes. Do I qualify for a food card? I can let you know, Miss Rainey. Just reach out to me. Again, those are kind of like the specific questions that I talked about earlier when it gets into specific benefits that I cannot say. But what I can say is that they did move a lot of the money and put in the qualification to get those types of things now, that you should have a chronic condition. Okay, I can say that. So if you do have questions like that, you know, again, scan, reach out, we could do that. Also, this is another thing I wanted to add to about the whole chronic thing, right? The chronic plans this year, like some companies, they have made sure they've had one in all 50 states. Okay. So this is a big deal. And, you know, more than half the population has, you know, high blood pressure, diabetes, and things in order to get them. So there is a chance that you could really get one. Okay. So let's move on. And now, listen, what's coming up? I'm going to talk about dual eligibles, and I'm going to talk about veterans. Okay, that's what I'm about to talk about. I'm going to talk about later in this video, whether you have Tricare, VA only, Chant VA. I'm going to tell you exactly what you should be looking for in a plan. I'm also going to talk about in this video, if you are still working, okay, exactly what you should be looking for in a plan. So make sure you're hanging with me, okay? Because I told y'all this is going to be the only video that you need to watch in order to choose a Medicare Advantage plan this annual enrollment period. All righty, this is it. All right, hey there, Miss Belinda Drake. She says, do Medicare approve GLP-1 weight loss drugs? They did something with the weight loss drugs recently. They did. And there are plans that are covering GLP-1s. That I know. I was shocked. There are plans, okay? So that's good news. If you are on some weight loss medications, there are plans that are now covering it. That is like breaking news that has happened. So I do want to let you all know that. So I'm excited about that. Okay. What else did they say? So another person asked, Thomas Clark, good evening, everyone. Wish you a happy and blessed holiday season. Thank you so much, Mr. Clark. We appreciate that. All right. Next up, let's talk about Dorothy dual eligible. Now, a dual eligible is a person who has both Medicare and Medicaid. That is what a dual eligible is. Medicare, you get again by turning 65, okay, working at least 20 quarters, that is how you get Medicare, right? Or if you get end-stage renal disease, that's kidney failure, you get Medicare. Medicaid is based all on your income. So if you have a certain amount of income or lower than a certain amount of income, you could be eligible for Medicaid, okay? And if you have Medicare and Medicaid, you can be a dual eligible. There are different levels of Medicaid too. So I want to let you all know that they have what they call a full Medicare eligible person, full dual eligible, right? FBDE. They have a qualified beneficiary, a slim B, right? It goes all the way down the line. And what each level does, it depends on how much you would have to pay out of pocket or cost share, which your responsibility will be. When you have a dual plan, you usually get more benefits, right? Those are the people who get the $5,000 dental. Those are the people who are getting the $300 or more food cards and things like that. Used to be. Now, again, they're adding on, okay, the chronic conditions for some of these plans. So you definitely want to make sure. So when you're dual eligible, it's a good thing if you could qualify for one, and you want to make sure you have a dual eligible plan, okay? So, and that's it. That's my recommendation for you to have a dual plan. Okay, so Ms. Drake said, yes, because my mother and I both have chronic conditions and the same insurance, but different food card benefits. Yes, it depends on your level of Medicaid, because just because you have Medicaid, okay, and a plan has a dual plan, does not mean that you automatically qualify for that plan. It doesn't mean that, okay? And I just want to let you know that. And so when you are dual and you are looking for a plan, you need to make sure you qualify for it based on your level. And when it gets to that, that is something you're going to have to work with an agent like that for. Do dual plans pay for hearing aids? Each plan is different. However, if you're in a dual plan, it's a very good chance it does. Okay, but each plan is different. And I know that because hearing is very expensive. But those type of things, the thing about a dual plan is designed for you to pay as little money out of pocket as possible. So let's move on to veterans, okay? Veterans. Thank you for your service. Okay. Veterans are a special case. And with that, I have broken this up into 3 different scenarios, because when it comes to veterans, it'll 3 different scenarios. You said you'll be getting back with me. Please do. Listen, AEP is about to be over. Okay, so you go ahead and scan, call the office, go online, hallinsurancegroup.com. Right there it says schedule, click it, because AEP is about to be over. If you're watching this after the annual enrollment period, still feel free to reach out to our office. Okay, again, this is a great reference piece and we can still help you. All right, so first things first, should veterans consider getting Medicare Advantage plans? Okay, let's talk about that. Why should they? Yes, they should. Okay, let me just go over that. And the reason why is for a few things. First of all, it gives you access without having to go call the VA. Okay. Now, if you have Tricare and you can go, that's fine. But Tricare, it only gives you $1,500 dental. Okay, that's the benefit. A lot of times people think, oh, it's unlimited if you have a Tricare. No, it's not. Also, a lot of times people think if you're a veteran that everything is free. We know, those of you all who are veterans, you have out-of-pocket costs now at the VA, okay, unless you have 100%. So it can also help with that, okay? If you travel, you don't have to go to a VA. It's a lot of benefits that the Medicare Advantage plans could provide and not interfere, all right, which is important, and not interfere with your veteran benefits. They don't take them away or anything like that. And I know that's a fear, but they don't, okay? But there are some caveats, and I'm going to go over that based on each situation. So this is the part really, okay, that if you are a veteran that you want to save, that you want to send, because I'm about to break it down. Okay, here we go. So first is Tyrone Tricare. So Tyrone Tricare, he's the person, he served the 20 years in the military and he's retired. That's that. So he's eligible for Tricare. Okay, so the full 20 years. Now, with him, since he's on Tricare, okay, he should get an MA only plan. Okay, that is my suggestion. Okay, that's my recommendation. It doesn't include a drug plan. Okay, that's why we call it MA only, Medicare Advantage only plan. That is what you're going to get if you have Tricare. Because if you get anything else, it could mess up your drugs and stuff, right? That you get through the veterans. So you don't want to mess that up. That's why you get an MA only plan. Okay, if you have that situation going on. Okay. Also, with the plan too, you're just kind of just looking for it to help you, whether it's putting money back in your check to help out with that Part B, because if you have Tricare, you have to get Medicare Parts A and B. You have to pay for it. So you might want to, get that give back plan like we talked about earlier, or you might want more dental coverage, right? So you're looking at the supplemental benefits, right? You want a gym membership, you want over the counter benefits, you want more dental, you want more vision, those type of things. That's what you're looking at this for, not necessarily the medical, not necessarily the drugs, because you have that covered. Now, one of the things that I do want to caution you about, if you have Tricare and you're going outside of the VA and you're getting one of these plans, is that you want to make sure that whatever plan that you get, your doctors are in network with it too. So if you, again, you're on Tricare and you have a Dr. Johnson, okay, and they go to Liberty, and they're out of Liberty Hospital. Well, you want to get a Medicare Advantage plan that works with Liberty Hospital as well. Medicare is always going to be your primary, right? And that Medicare Advantage plan will also be your primary. Tricare will be your secondary, right? They work together like they've been working together. However, if that doctor is not in network, okay, you won't be with the Medicare Advantage plan, you won't be able to go to them anymore. Okay. So you want to make sure, there's a lot of benefits with the MA plan that you could utilize, but you want to make sure that whatever plan you get, the doctor is in network with that. Okay. That's the number one thing to making this all flow together. You won't have to pay any more out of pocket or anything like that. You continue as business as usual, which is great. So you're not going to have to pay anything extra. You're going to be able to use all the benefits, but you've got to make sure that your doctor is in network. Okay, that's very important. All righty. Next up is Victor Veteran. Woo! Let's talk about Victor Veteran. Okay. Victor Veteran, okay, he went in the service for 8 years, right? He uses the VA for everything, okay? He has VA only coverage. He has Medicare Parts A and B, okay? Because again, to get a Medicare Advantage plan, you have to have both parts, A and B, okay? Oh, Belinda Drake, you asked which is the primary again? Medicare is the primary. Medicare is always your primary. All right. So, and if you're watching this and you have questions, go ahead and put in the comments. All right. So Victor Veteran, he uses Medicare Parts A and B only. Okay. Victor wants a plan that allows him to go outside of the VA. He might have got a diagnosis and he wants to get a second opinion, or the VA might be too far from him, right? And he doesn't want to have to travel 2 hours. Because once you get out of a certain geographical location, going to the VA is far, okay? So he might want to be able to go to a doctor in an emergency or urgent care without having to call and get an exception from the VA. This right here, Medicare Advantage plan, could be great for him. All right. Now, depending on his level and the convenience, he might just care about the supplemental benefits, like a Tricare Tyrone. Okay. So in that case, you want to just look for a give back plan or something that's going to give you a lot of dental, and that be that, right? Because you don't have any, because Victor doesn't have any problem going. However, if he needs a lot of care, he can get what we call an MAPD plan. A Medicare. So I actually have here, I have 2 suggestions, right? Recommendation, MA only plan. Okay. It doesn't include a drug plan. Or recommendation 2 is a MAPD plan, a Medicare Advantage prescription drug plan. That's a combo. With that, it includes both medical and drugs. Okay, both medical and prescription drugs. Because he is VA only, it will not affect what he has going on, his veteran benefits, like if he was in Tricare, like Tricare Tyrone. Tricare Tyrone should only do MA only. But Victor, veteran, he doesn't have Tricare, he can do both, which is great because let's say that outside doctor gives him a medication. He goes to urgent care. He has a cold and flu. They give him some antibiotics, okay? VA doesn't pay for antibiotics. They don't. But if he had a plan that's the MAPD, it would, and he doesn't have to get pre-authorization from the VA. Also, too, very important one here. Okay, let me tell you, this is the biggest reason why a person from the military, a veteran, Tricare, should get a Medicare Advantage plan. It is because, God forbid, if you get sick at a hospital, they will not have to transfer you to a military hospital. That's huge. Because if you just have VA only coverage and you get sick, okay, and you have a heart attack and you go to a local hospital, the military will get you stable, the hospital will get you stable, and they will ship you to the military hospital due to the finances. It happens all the time. However, if you have a Medicare Advantage plan, you can stay there and get well. That's it. That's the biggest reason I think is worth every penny of it. Okay. So a Medicare Advantage plan, that would be a good thing. Let's look at the questions. Okay. Maisha says, hello, Melissa. Can't wait to catch up in Medicarians. The information is always top notch and love all that you represent. Thank you. Thomas Clark says, Duke Medical Center and Medicare Advantage and Network, and does Humana Honors cover some costs? I can say that Duke is in network with Humana, and Humana Honors, it does cover some costs. I think I can say that without getting in trouble. All right. Y'all, they regulate me. They regulate us real hard, okay? All right, so we got that out the way. So let's talk about our last military example, okay? And I call her Chant VA Cheryl, okay? Chant VA Cheryl. She was a spouse of a veteran, okay? She has Medicare. Now, since when you're on Chant VA, you get something called meds by mail, okay? Meds, not mail, okay? Mail. Let me make sure I say that I. Meds by mail, meaning that the VA directly, they send you your medications. What does that mean? That means that, okay, you should only get a MA only plan, okay? And it doesn't include the drug plan. Also, one thing about when you have Chant VA, you also have a deductible that you have to pay before it kicks in. And if you have a Medicare Advantage plan, you do not have to pay that deductible. As long as your Medicare Advantage plan does not have to pay a deductible. Most of them don't, okay? So I want to put that out there. So that is what you want to do if you have Chant VA, okay? And also for my agents out there who are watching, I know this is great learning for you all too, because let me just say this, what I am teaching you all now, what I'm sharing with you, whoever is watching this, a lot of inexperienced agents, they don't know this. And a lot of agents are independent and they do not get training from these insurance companies. They have to find out a lot of it on the field. So if you're working with an agent who's been doing this less than 5 years, you shouldn't, I don't want to say you shouldn't be doing business with them, but you really need to double check with the information that you're getting from them. Because Medicare Advantage, Medicare in general, is a very nuanced a lot of ins and outs type of thing. And, there are good people trying to help you, but unfortunately, there is really no formal training for a lot of them. Okay. And like I said, I have been doing this for over 17 years. Okay. This is what I've been doing. This is my specialty. I could talk this in my sleep. Okay. This is why my company has helped 3,000 people. And, my clients are on here right now because I've been doing this a very long time, very experienced. So you want to make sure you're getting the right information. So Lois Pierce, good night, Miss Pierce. Good info about veterans. Thank you so much. Make sure you pass it on, okay? Somebody say any plans for business owners. It's all about Medicare Advantage. But actually, my last one tonight, I'm going to talk about a person who's still working. Okay. Thank you for veterans. Veronica Perry said, what about Chant VA? I just went over Chant VA. If you have Chant VA, you want to get an MA only plan. Okay. All right. So let's go over the final scenario. Okay. Can we say final scenario? All righty. Working Wanda. Okay, let's talk about working Wanda. Okay. And when I say working Wanda, I'm talking about a person who has Medicare. Okay. But they're still working. And when I say they have Medicare parts A and B. Okay. Not just Medicare Part A. Okay. And now, this is the thing. If you are still working and you have Medicare Parts A and B, let's just say you have Medicare Parts A and B already, not thinking about registering for it, you can actually, listen to this, depending on your plan at work, still have a Medicare Advantage plan and your work plan. That's right. And they can work together to help you with the cost. Okay. They can work together to help you with the cost. They can work together to still give you extra benefits, the dental, the vision, money back in your check. They can still work together. So you don't have to pick one or the other. See that right there? What you get with working with a more experienced person. And you would just have a primary and secondary type of scenario. Happens. You got to know. Now, you might be in another situation and you're like, okay, well, you might be in another situation where you're saying, well, Melissa, my work plan, I'm paying for it out of pocket. I want to know if Medicare is cheaper. That's fine too. Okay, that's fine too. You can get with the agent or you can go online using what I've taught you here. Okay, and you can see what would be cheaper for you. And what you want to look at, because just because it's for work, it doesn't mean it's the best. Because a lot of times work plans, first of all, they don't go by the same rules as Medicare, meaning they don't have to cover all your preventative services out the gate. They don't have a limit on the maximum out of pocket that they can charge you. It's based on the company's budget. Okay. It's a lot of rules that they don't have to have. And actually work plans, from what I hear, they're going crazy this year as far as the cost. Also, with the work plan, they are usually geared for people who are younger, right? Who are working, right? Still working. That's why they call it a work plan. So I would say compare the cost. One thing is this, if you are still working, you're going to have to pay the $185. It actually goes up to $200 for 2026 for that Part B, maybe more because you're still working. So you're getting a higher income. Okay. So that's number one, you want to keep in mind. Okay. Also, you want to keep in mind too, though, the deductible. That work plan deductible is high. Okay. It's in the thousands usually. Where a Medicare Advantage plan, then they're not that high as far as the deductibles. Okay. And there's some other things as well. Now, you want to look at what you have going on. Do you have any upcoming surgeries? Okay. Things of that sort. If you get out of the work plan, can you get back into it? If it doesn't work out, do they accept it? Because I will say this, there are some doctors who might accept the commercial, which would you work, let's say commercial Cigna, but they don't take Medicare Cigna. So you want to make sure your doctors accept that, because they consider them two different things. Just because they take Cigna on one doesn't mean they take it on the other. Okay. So those are the type of things you want to definitely look at, especially like mental health. I will say psychiatrists and stuff, they are very finicky when it comes to taking insurance in general. So I do want to talk about that. Someone said, oh, Betty Johnson, she's working Betty. Miss Gwen Green said, I have Tricare and Medicare Advantage that I got from you last year. Do I have to renew it, or will it just start over 2026? If you haven't, so let's talk about that. If you haven't got notification that your plan is leaving the area, you can just keep the plan. You don't have to do anything. Okay, that goes for anybody watching this video. If you like your plan and your plan will still be in your area next year, you don't have to call your agent to do anything. You don't have to change anything. The plan will give you a card, a new card for the next year. They'll send it in the mail. You don't have to do anything at all. Every plan sends out what they call a an annual notice of change. They have to send it out by September 30th of every year with all the changes for the plan for the next year. And you can read that and see what has gone on. Okay, I want to put that out there. So you don't have to do anything at all. If you like the changes, if you like your plan, it's nothing you need to do. Okay, just make sure you have parts A and B. All right. You said you need to talk to me. Please, if you would like to talk to me, make sure you scan my QR code, go to my website, or give us a call right there. Again, we are open 24 hours a day, and you can get an appointment scheduled right away. Right now, with it being between October 15th and December 7th, we are doing appointment only. We are booked. We do have same day appointments, but we are booked. If you all could imagine, with our book of business, we have people calling us a ton, so we are only doing by appointment only. Thank you. She said you can't get no better when dealing with Melissa. For real, keep on going. Thank you, Mrs. Drake. I appreciate it. Listen, like I said, I've been doing this a very, very long time. I can do this in my sleep. All right, next up, let's see. All right. So I think we have covered everything, every scenario we have covered here today. Again, I do appreciate you. Save this, share this wherever you are watching this. This is the only video that you need to watch to determine what type of Medicare Advantage plan you should get. Okay, you don't need to do anything else. Save this video, maybe even rewatch it again, save it to your favorites, subscribe to my channel, all the things. But this is it. This is the video. Whether it is during the annual enrollment season or after, the same applies. Okay? You don't need to look at any other video. This is it. All right. Thank y'all so much. Like this video. It helps with the algorithm. Okay. That's why I keep asking y'all. It'll replay. Yes, it'll replay. So if you have this link, wherever it is, it'll replay. If you are on my text list, in order to get on my text list, if you go to melissadhall.com/get well with Mel, I have a little form up there. It says get on my text list. Just go ahead, put your name up there, and I send out replays for all my broadcasts. Okay. Usually I do a live stream every Thursday at 5:30. Because it is Medicare Annual Enrollment season, it is December 7th, I won't be doing it this Thursday. So this is it right now. We're doing this on a Wednesday. But, you know, moving forward, every Thursday at 5:30, we're always streaming about different topics. And on this channel, I do give a lot of Medicare and health information. Thank you so much for watching. Have a wonderful day.